Hello everyone, myself Hridya, Assistant Professor from the Department of Optometry, Yenepoya School of Allied Health Sciences, Yenepoya deemed to be University, Mangalore. Today we will be discussing on the topic presbyopia. To begin with the specific learning objective, at the end of the session, the audience will be able to define presbyopia and explain its pathophysiology, describe the age-related changes in presbyopia, mention its causes, clinical features and symptoms of presbyopia, and explain various optical and surgical treatment options for presbyopia. So to begin with the definition, presbyopia is not a refractive error but a physiological condition characterized by the gradual loss of eye's ability to focus on near object due to insufficient accommodation. So this typically begins between the age of 40 and 45 years. So this is what happening during an accommodation. So near responses of the eye, while we looking at the distant vision, the rays are coming from the infinity and focused on the retina, and when we are looking at a near object, what happens is mainly ciliary muscles will be contracted and the constriction of the pupil happen and thickening of the lens happen, and in order we will get a clear vision in the retina and we will be able to focus on the near objects. So as the age increases, the ability to focus near object gradually decreases. So this will lead to presbyopia. So coming to the pathophysiology, presbyopia results from a reduction in the amplitude of accommodation, which is the eye's ability to change focus from distance to near objects. In a normal emmetropic eye, so emmetropic eyes are normal eyes which is not having any refractive error, the far point is at infinity and the near points varies with age. So at the age of 10, we will be having a near point which is approximately at 7 cm with an amplitude of accommodation of 14 diopter, and at the age of 40 the near point will be at 25 cm with an amplitude of accommodation of 4 diopter. As the age increases, the near point increases and the amplitude of accommodation decreases. So the reading distance is typically around 25 cm which require about 4 diopter of accommodation. As amplitude drops below this level, near vision becomes difficult. So presbyopia occurs when the punctum proximum, that is the point of clear vision, which recedes beyond normal reading distance. So coming to the causes of presbyopia, mostly presbyopia is an age-related condition, and age-related changes in the crystalline lens, decreased elasticity of the lens capsule and progressive sclerosis and increased hardness of the lens substance can lead to presbyopia. And also there are age-related changes that also decline the ciliary muscle strength will cause to presbyopia. And coming to the causes of premature presbyopia, so premature presbyopia means the presbyopia mostly occurs at the age of 40 or 45, and before whatever presbyopia is happening before the age of 40 years is called as premature presbyopia. So for the causes of premature presbyopia, uncorrected hypermetropia, premature lens sclerosis, general debility and ciliary muscle weakness, chronic simple glaucoma are the causes. Coming to the clinical features, coming to the symptoms, difficulty in near vision, that is trouble reading small prints at the usual distance, holding reading material further, and these symptoms will worsen in dim light. And also asthenoptic symptoms like eye strain and fatigue during or after the near work. And also sometimes patient may have difficulty in intermittent diplopia. Diplopia is double vision and it is due to the disrupted balance between accommodation and convergence. So symptoms onset are various depending upon the refractive status of the patient. So for an emmetropic patient, the symptoms will start approximately around the age of 45 years, and for a hypermetrop, if it is uncorrected, that their symptoms will be shown before the age of 45 years, and for myopes, the symptoms are shown very little later, sometimes if it is unaffected if the myopia is approximately greater than -3 diopter. And also these symptoms are worsened by fatigue, illness, fever and other debilitating conditions. So coming to the signs, mostly while we are looking for the near vision testing, both monocularly and binocularly, the near vision will be poor, and also during subjective testing, the there will be showing reduced accommodative power for near task. Coming to the treatment options for presbyopia, first is the optical treatment and the other is the surgical treatment. So coming to the optical treatment, we have some principles we have to ensure before giving optical correction. The first is the distance refractive error must be corrected first, and the weakest possible convex lens that allows comfortable near vision has to be prescribed, and also we have to retain 1/3 of the accommodation in reserve. So that is given in order to reduce the strain. And this is the rough estimate of presbyopic ad based on the ages. So we'll start with plus 0.50 to plus 1 diopter between the age of 40 to 45 years, and as the age increases, the power of the convex lens, the plus lenses, that also will increase up to 60 diopter. After 60 diopter, we will give a plus 3 diopter. Coming to the spectacle option, we have single vision reading glasses, bifocals, trifocals and progressive addition lenses. So the single vision reading glasses will be either distance or for near. So the patient has to wear alternatively whenever if they are having a distance, they needed a distance correction, they have to use their distant glasses, and whenever they need glasses for the near work, they have to use their near vision glasses. And coming to the bifocals, bifocal glasses are having two segments, one is for distance and the other is for near in the same spectacle plane. So they don't need to change again and again like a single vision reading glass. So coming to the trifocals will be having distance, intermediate and near segment. And coming to the progressive addition lenses, there will be progressive change in the power from distance to near. Coming to the contact lens option, we have bifocal contact lenses, multifocal contact lenses, monovision lenses. Monovision lenses, for one eye they will be for near and the other eye correction will be for the distance, and we have modified monovision glasses or hybrid designs. So this is the type for bifocal contact lenses. We can get it in concentric bifocal contact lenses, aspheric design and also in translating. So there will be distance and near vision correction in the same contact lens. So this is the multifocal contact lenses. There will be near, intermediate and far. Coming to the surgical treatment, we have so many techniques for presbyopic correction, which includes intraocular multifocal lens, corneal inlays, presbyLASIK, conductive keratoplasty and lens brace procedures. So presbyopia is a progressive condition. So lens power will need periodic adjustment, and also the patient's lifestyle and occupational needs should be considered while we are prescribing for the correction. So to sum up, presbyopia is an age-related physiological condition marked by a gradual decline in the eye's ability to focus on near object due to reduced lens elasticity and weakening of the ciliary muscle. Common symptoms include eye strain, difficulty reading small prints, that is normal distance, and common treatment option for presbyopia is spectacle correction for near. This is the reference I have used, and thank you.